The gentleman from Louisiana is recognized for 2 minutes.
I thank the gentleman, and I appreciate Dr. Burgess allowing me to speak on this specific bill. But let's just talk about the elephant that's in the room here this afternoon, and that is the so-called Affordability Act, the so-called Patients Affordability Act, PPACA, perhaps we call it Obamacare affectionately. Folks, we've got a bill here which is now law that is at best questionably constitutional. We have a bill that's going to add another $1 trillion ultimately to our deficit. It's full of smoke and mirrors. We've got $500 billion that's going to be taken out of Medicare and then put on both Medicare and then on subsidy of the private health plans, even if we ever save that $500 billion. This whole law has questionable financing, and then today we're talking about construction money that may or may not exist. So, Mr. Speaker, I just have to say, as a physician of 30 years of practice, I was here during the health care debate in 2009, where this body has come up with, and the President has signed into law, into something that's really a disgrace. The American people are not behind it. PPACA is, in some surveys, opposed by the American public 2-to-1. It is a complete government takeover of our health care system. Just the other day, I got questions from my constituents, physicians, who asked me, what about this iPad? What is that? What is this board? And I had to explain to them that now when you're not sure how much you're going to be reimbursed for the health care that you provide, you can at least go to Congress and petition Congress.
Gentleman, 30 seconds.
Gentleman's recognized.
But under Obamacare, we now have IPAB, which is a board, a special board of unelected, unaccountable, unnamed bureaucrats that serve at the pleasure of the President, who will then decide these things, creating a non-market responsive health care body out there that will then we'll see much worse shortages than what we have today. So I stand in support of Congressman Burgess and his bill, and certainly the repeal of Obamacare.